Hello, my name is Mari and my group members are Bart, Winnie, and Christina. We conducted a zone inhibition study titled The Effects of Cinnamon and Peppermint Oils on Common Oral Microorganisms. Essential oils have been used by many civilizations for their nutritional, cosmetic, and therapeutic potentials. Cinnamon oil is a potential antimicrobial agent that has been used in traditional medicine for thousands of years. This oil contains natural compounds that have been known to possess antimicrobial activity. Peppermint oil has been shown to reduce plaque and assist in improving oral health. The problem is that common oral microorganisms cause negative effects in the oral cavity, such as dental caries and oral candidiasis. So it is important to reduce the number of these microorganisms. Therefore, the purpose of this study was to determine the antimicrobial effects of cinnamon and peppermint oil on 5 common oral microorganisms using a zone inhibition study. Our study supports the National Dental Hygiene Research Agenda, area of oral health care, and the discovery of new therapies and prevention modalities, as well as testing and evaluating treatments for health promotion and products.
The 5 oral microorganisms used in this study were Streptococcus mutans, Streptococcus salivarius, Enterococcus faecalis, Pseudomonas aeruginosa, and Candida albicans. These microorganisms were selected because of their regular occurrence in the oral cavity. Streptococcus mutans is commonly found in the oral cavity and is a significant contributor to tooth decay. Streptococcus salivarius is an opportunistic bacteria that exists in normal flora. Enterococcus faecalis is an opportunistic bacteria that inhabits the gastrointestinal tract. The oral cavity can serve as a reservoir for Pseudomonas aeruginosa in elderly and immunocompromised patients. Candida albicans is an opportunistic pathogenic fungi that can be found in the oral cavity. We began by growing and incubating the 5 common oral microorganisms in a nutrient broth for 72 hours at 37 degrees Celsius. Next, 75 agar plates were divided amongst the 5 microorganisms with 15 agar plates per microorganism. Each plate was labeled with the name of the microorganism and divided into 4 sections for each treatment. The 5 microorganisms that had been grown for 72 hours in a nutrient broth were introduced to the entire plate using a sterile spreader. Each section was then treated with cinnamon oil, peppermint oil, and the negative and positive control variables, water and chlorhexidine for C. albicans, and water and vancomycin for the 4 other microorganisms. The oils and control variables were added to the plate using sterile paper discs, while the vancomycin already came in disc form. Both essential oils were pure oils from the same brand. Once the treatment was added to the plates, they were incubated for 69 hours at 37 degrees Celsius. The results were measured by one group member using a metric ruler to determine the widest diameter of each zone of inhibition created, if any. If no zone was created, we documented the measurement as 0. All other measurements were recorded in millimeters.
An analysis of variance, or ANOVA test, was conducted using IBM SPSS version 27 to analyze the zones of inhibitions, and after running descriptive statistics, the following results were found. For both S. mutans and P. aeruginosa, the zones of inhibition for cinnamon oil was significantly greater than water and peppermint oil with a p-value of less than 0.05 and equal to the zone of inhibition created by vancomycin. You can see in figure 1 that the zones for cinnamon oil and vancomycin are similar in size. There was no significant difference between peppermint oil and water. For E. faecalis, cinnamon oil displayed a significantly greater zone of inhibition than water, vancomycin, and peppermint oil with a p-value of less than 0.05. Here, peppermint oil showed a significantly larger zone of inhibition than water, but was significantly smaller than vancomycin. For C. albicans, only 7 out of the 15 agar plates were used due to contamination in which other bacteria were exposed to the plates prior to incubation. There were no significant differences between cinnamon oil, peppermint oil, and water, and there was a significant difference between both oils and chlorhexidine, with chlorhexidine having a significantly larger zone of inhibition in the 7 plates evaluated. All plates of S. salivarius were excluded from the study, as they presented overlapping zones and a fogginess that made them impossible to measure, which can be seen in Figure 2. As a visual aid, we created a bar graph for the mean measurements for each microorganism. As you can see in Figure 3, cinnamon oil presented better results than the control variable, vancomycin. And the only microorganism in which peppermint oil showed slightly better results than cinnamon oil was C. albicans.
In conclusion, cinnamon and peppermint oils reduced oral microorganisms significantly. Previous research also indicated a significant reduction in oral microorganisms when testing these two oils. A strength of the study was that researchers were calibrated in their assigned roles and used a sterile technique. The study's limitation were the exclusion of S. soverius due to foggy plates and overlapping zones, along with the contamination of some plates creating a smaller sample. The clinical significance of this study is the potential antimicrobial effects of cinnamon and peppermint oil against oral microorganisms that can cause conditions such as dental caries and oral candidiasis. Future research using cinnamon and peppermint oil should be tested in human subjects to evaluate their antimicrobial abilities in the oral cavity and any oral effects to the soft tissue. The use of cinnamon and peppermint essential oils may allow for a more holistic approach for patients, dental professionals, and dental product manufacturers. Based on this study, are you willing to recommend these essential oils to your patients? Thank you for listening, and we look forward to answering any questions you may have.